We have had a frantic week, but a productive one. So far, we have been lucky. There are no cases in Singapore. As you just heard, the virus has spread now to at least 21 countries, and the global response has been robust. Mexico in particular has been transparent and decisive. Its early alert and its bold decision to close the country down for 5 days at great cost to the economy is highly commendable and responsible. Outside of Mexico, the virus is proving to be mild. WHO alert level is at phase 5, and it may further raise it to the final phase 6. If it does, we should not be shocked, as the WHO alert level merely refers to the geographical spread of the outbreak. It does not imply severity. You see, in public health management of viruses, really the two key indicators are attack rate, how many people get infected, and fatality rate, how many people die from it, or the degree of severity. And these are the two key parameters. So if you look at history, of course, the biggest fear, which is our code black, is if both are high. In other words, high attack rate and high fatality rate. Now, so many people get it easily, it is highly contagious, and among those who are infected, many die. And in history, really, you can think of the Black Death in Europe. That is, both parameters are high. And this is the most feared scenario. The second level of severity will be the fatality rate is high, but the spread is not so high. Attack rate is not so high. Now, it's not so easy to get it, but if you're the unlucky one, you get it, your chance of dying is very high. And this is, the closest to this will be SARS. So SARS is like that, will be of this second category. And there will be a code red for us, a red 2, And the third will be that it is very contagious, you get it easily, but it is also quite mild. And there will be some death, but fatality rate is low. Rate is low, but the quantum may not be low because many people get it. So even though it's 0.01%, let's say, there will be still death. But like all things, it is one of those that the fatality rate is low, and you have to take death, interpret death, with the right in the right perspective. And the third category will be your normal seasonal flu. Singaporeans may not know it, but every year, a few hundred Singaporeans die of flu. So it is not as if there are no deaths. In fact, the number of deaths is not small, but the fatality rate is low, and prevention is, as usual, exercise, keep yourself healthy, and in fact, if you look at flu death, seasonal flu death in general, these are people whose health are already compromised. They are quite sickly to begin with, immune system is low, and therefore flu attacks them. And flu itself may not be the main killer. It's just like the second death just reported the last 24 hours in Texas. The poor lady was already very sick with other illnesses. Unfortunately, H1N1 comes along and just complicate matter, and she died. So this is how we look at viruses, public health issues, and your response have to commensurate with the category. Within Singapore, our alert level is currently at orange. I'm impressed with the response from Singaporeans, patients, our hospitals, clinics, airport, checkpoints, schools, kindergartens, companies, ministries. Years of pandemic preparation are paying off. Singapore moved into orange readily, without much fuss. Singaporeans did well last week with distinction. There was no panic, and Singaporeans took the inconvenience in its stride. I know that many have been inconvenienced, patients, visitors who got prevented from visiting their loved ones, office workers, all of us who come to office have to need to get their temperature checked. Visitors to mass events are subjected to temperature screening. And the few return travelers from infected regions need to be quarantined. I'm grateful to them for taking the inconvenience in its stride.